Welcome back to Cheddar's Opening Bell. President Biden announced new plans to combat COVID-19 yesterday. He said the U.S. will administer booster shots to millions of Americans. Nursing home staff should be fully vaccinated to be eligible for federal health care funding, and schools should require masks. While these new announcements are not surprising, they do come with some questions. So joining us now to break it all down is Dr. Ernest Patti, Senior Attending Physician of Emergency Medicine at St. Barnabas Hospital in the Bronx. Thank you so much for joining me, Doctor. Now, before this announcement, and medical experts have said a booster shot is needed for the immunocompromised, but not so much for the others. Now the president is saying everyone is getting it. So is it necessary for an average healthy American to get the booster shot right away, or should they wait for the immunocompromised to get it first and then go ahead and get in that line?
Well, I definitely think we should wait for the immunocompromised, the elderly, and those people with chronic health conditions to probably get those shots first, along with the frontline healthcare providers. Because let's face it, having been a healthcare provider on the front lines in the Bronx during this pandemic, I've seen my shares of heartache regarding COVID-19. At our hospital alone, we lost 5 beloved colleagues from the virus, and this was before the vaccine was released. So yes, we should be giving it to those vulnerable groups first.
Now, Pfizer and Moderna booster shots will be available late next month, but what about those who got the single dose of J&J? Should they mix and match their vaccine shots, or should they wait it out?
Well, to be honest with you, I'm not an infectious disease expert, so I shouldn't really comment on if you can mix and match the vaccines, but I think the CDC would give us the best guidance as to using one with the other. My feeling is, look at it this way. Every year we get a flu vaccine to boost our immunity for the flu because the virus mutates itself and is very clever and wants to survive. So my thought is COVID-19, being a virus as well, has those same properties of mutating. And we're seeing that now with the Delta variant and the Lambda variants. So my thought is, I'm assuming moving into the future, we will be getting booster shots for this immunity protection to boost us up for any latest variants.
Now, speaking of mutations, the World Health Organization and the global community are saying that the decision to give booster shots for everyone in the U.S. is selfish, given that there are severe vaccine shortages around the world. What are your thoughts?
Well, my thoughts are the U.S. always helps the rest of the world. I agree. As far as it being selfish, you know, we need to protect our own first, definitely, and that would include our nursing home population, our immunocompromised population, our pediatrics, those who are on chemotherapy. So I think the people that are in power in our government need to really look at it carefully and decide. We're always going to help the rest of the world. We're not going to leave them in the lurch. At least that's the way I grew up in this country, believing. But we definitely need to care for our own first. And then I'm sure we're going to have leftover or excess vaccine, and we can send out to get problem populations that don't have vaccines vaccinated as well to spread the immunity and help cut down on the public health risk in general. Remember, if we don't vaccinate the entire world, this virus is not going to be eradicated.
Now, President Biden is imploring states to require masks in school. He's even saying that he has directed the Department of Education to use its broad powers to deter states from banning the mask mandate. Do you agree with the push?
I agree that we should be wearing masks. I mean, we saw that the benefit of wearing masks. It cut down. Look at our flu season last year. It was very, very low. We didn't see much flu because people were wearing masks, washing their hands, sanitizing, paying attention to this stuff. I really think masks in general do help. They cut down on the spread. And I think that school children should be wearing them until we get this pandemic under control. I think throwing the masks away and now going back out and being in crowds, you never know who's vaccinated, who's not, who's sick, who's not. It's tough to tell. So I think it's a good idea to keep wearing masks. I wouldn't throw them away yet.
What do you think of Biden's strategy of him saying that nursing home staff should be vaccinated in order to continue receiving federal funding for Medicare and Medicaid? What do you think of that strategy? Because I assumed that they already were vaccinated. I didn't realize it was just such a push to get them vaccinated too.
I can tell you from my own personal experience, it's a privilege to be a physician. And when I became a physician, I took a Hippocratic oath to do no harm. To me, do no harm means also keep myself as healthy as possible to prevent me spreading disease to my patients. Now, that to me makes common sense then that I need to be vaccinated. I was one of the first to get vaccinated to protect myself so I wouldn't inadvertently harm any of my patients. All nursing home staff, as far as I'm concerned, all hospital staff who work in direct contact with patients should all be vaccinated. It's a no-brainer to me. Why is there even a thought of, well, I won't get vaccinated? You're working in the healthcare industry and you're entrusted with the health and safety of patients. My strong feeling is you should be vaccinated, hands down. Healthcare, nursing homes, rehab centers, hospitals, clinics, everybody should be vaccinated.
No objection here, Doctor. I appreciate it. Dr. Patti, Senior Attending Physician of Emergency Medicine at St. Barnabas Hospital in the Bronx. Thank you so much for being on our show this morning.